Which of the following statement regarding physiologic tremor is true? Physiological tremor are reduced during anxiety? No, they are increased during anxiety. Why? Because when there is anxiety, there is increase in the gamma motor neuron discharge. There is increase in the gamma motor. And if you remember, gamma motor causes increased sensitivity of the muscle spindle. So if there is increased discharge of the gamma motor, there will be increased sensitivity to the muscle spindle. Okay. So that is why muscle contraction will be more. And the dynamic response of the muscle spindle 1A sensory fiber help dampen the oscillation in the feedback loop, regulating muscle length. Absolutely true. Absolutely true. So we know in the muscle spindle, if you remember, it was taken by whom? It was 1A and 2. And then the efferent was gamma and efferent was alpha motor. It was called as alpha gamma co-activation. Alpha was causing muscle contraction, gamma was causing what? Increase in the sensitivity of muscle fiber. Okay, so dynamic response of muscle spindle. There is a dynamic response and there is a static response. So this is your muscle spindle. It is a whole 1 hour discussion in the main video. If you remember that, they have dynamic, they have static. If you remember, we have nuclear back fiber and we have nuclear chain fiber. Nuclear back fiber are two types, dynamic and static. Dynamic will sense change in the velocity of length of muscle. Static will sense only static change in the length. Okay, so the dynamic response of muscle spindle help dampen the oscillation. This is very important. Suppose if you want to hold your hand like this, you can hold my hand like this only because of this feedback loop. Okay, so it is true, it will reduce the tremor. It will help in dampen the oscillation. Third, physiological tremor is independent of central source. No, it is dependent on central sources, olivary nucleus, and is caused by peripheral factors such as reflexes and motor unit firing. No, it depends on the central factor as well as peripheral factor like reflexes and motor unit firing, which I discussed just now. So it depends on the central factor as well. Okay, sensitivity of the muscle spindle to the velocity of the stretch exaggerate physiological tremor. Now this is a tricky point. This is a tricky point. Sensitivity of the muscle spindle. Muscle spindles are very sensitive. They are very sensitive. Why? Who is doing this? Gamma. Now you will think that anxiety will increase the tremor. So how gamma will increase the sensitivity? Gamma is increasing the sensitivity, but it is creating an imbalance. It is anxiety is creating what? An imbalance. So tremors will increase, but gamma is going to increase the sensitivity of muscle spindle and reduces the tremor. Reduces the tremor. So gamma motor discharge. Gamma motor discharge, if they are appropriate, if they are appropriate, they should not be very excessive as well, then it will increase the sensitivity of the muscle spindle and they will reduce the tremor, not increase the tremor. Spindles are there to balance you. Okay, it is called as stretch reflex. Why I have discussed this chapter in a detailed video. There is a detailed video. If you have good idea, it's okay. If you don't have good idea, please see the video. It is one of the most important chapter, spinal cord reflex. The basic of integrity of your posture is stretch reflex. Clear, doctor? So if there is anxiety or there is a thyrotoxicosis, in all those conditions, we can have tremor because of imbalances. Otherwise, if they are well balanced, spindle are well balanced, if they have good sensitivity, tremors will be minimum. It is not, they are not usually visible. They're very minimum. If you want to hold your posture, there are few physiological tremor which are usually not visible, doctor.